and our phone number is 81. I don't know our phone number.
We'll cut that part out. We'll just end it at 450 North Brand. Hello everyone, welcome back to Kandid Koffee. I have Tagui Sarkisyan here with me today. She is the founder of Steps Fertility. Thank you so much. I have waited so long to talk to you on this show, but I know you're extremely busy and you're helping so many people, so thank you for your time.
Thank you so much for inviting me. I'm super excited to be on the show.
Likewise. We're at your office, for anyone who's asking or wondering. You're located in Glendale and you've helped hundreds of families with their fertility and fertility issues and other related problems that they might be facing. So I know in the community it's difficult for us to process things like that. So you being Armenian helps with breaking all that down and sympathizing with them, I'm sure.
Yeah, absolutely. I started, I'm one of those people who are lucky in life who knew exactly what they wanted to do. Mm-hmm. And I knew I always wanted to work with women and reproductive medicine. And when I was about 20 years old, I was introduced to reproductive endocrinology, and I had the pleasure of working with some really amazing physicians. So in the 15 years, I was exposed to a lot of Armenian patients, and mm-hmm. it really became a passion to address some of the issues that we have within our community.
Yes.
Couples who are really struggling with infertility, it's usually a very private issue. Mm-hmm. It's something that they rarely share with friends mm-hmm. and family. But the most important thing, and that's okay to be private about it, but I do want couples to know that they're not alone. There's hundreds of families that are struggling with similar issues. Mm-hmm. And for those women who do want to talk about it, the more we talk about it, the more we take away from the stigma and the taboo, because yes. at the end of the day, they're trying to have a beautiful family. I mean, what's better than that? Mm-hmm. So it did become a mission, I would say, to work mm-hmm. with the most difficult cases, which is where Simple Steps Fertility was designed. Mm-hmm. So all the couples who've already gone through IVF cycles over mm-hmm. and over, and artificial insemination cycles. Mm-hmm. Those couples who are now at a point where they have to decide, am I going to adopt, or mm-hmm. is there another option for me? And mm-hmm. there is another option. It's called third-party IVF, mm-hmm. and that's when we use egg donors, surrogate mothers, mm-hmm. or sperm donors to reach pregnancy and have a healthy baby at the end of the day.
Mm-hmm. Mm-hmm. Yeah, I knew of surrogacy, surrogate parents, or that whole process, but when I'm learning more and more that it's becoming more and more acceptable due to the education that people like you are providing for people in Armenia and here too. Mm-hmm. Sometimes they'll ask such ignorant questions, and you're just like, oh, it's just you don't know, and right. you're assuming, and you're you're so closed off to that concept that you don't even want to accept the fact that that's a very healthy alternative, because the other alternative is to be possibly very miserable and sad and not get the family that you had once imagined. Mm-hmm. So what are some of those challenges that you might, maybe not the couple, because the couple is the one who wants it, but maybe like a mother-in-law or like a parent mm-hmm. or somebody in the family? I mean, any kind of like, naysayer.
Well, yeah, that's a very good question, because infertility is something that ripples in the family. Mm-hmm. Mother-in-laws are involved, mm-hmm. Brothers and sisters. Everybody really wants the best for the couple. Everybody is really encouraging them because they want something positive. They want a new baby. Baby brings luck, love, everything to the family. Mm-hmm. But sometimes it's very burdensome to the couple because they want the baby 10 times more than you want the baby.
Right.
And that's okay. I mean, when we talk to families, first we talk to the couple, and mm-hmm. we want to know what they're comfortable with. A lot of things are private, and it should be only discussed with the couple.
Right.
And at other times, it might be helpful to actually explain the process to maybe a mother-in-law who is expected to be part of the process, and helping her understand and making it okay, and helping her understand that the baby is not going to be different because they're going through like in vitro fertilization.
Right.
That to me is something that I'm very happy to do, is to shed some light and some knowledge and bring some acceptance and make everybody feel a lot comfortable about the process.
Yeah, absolutely. I think it's the fear of not knowing and that discomfort, and like also the judgment of others, and which we ourselves, like as a parent or even as a spouse or something like that, are judging, and then we're afraid of the other judgment that comes in. So I just think that through knowledge they will become more accepting, and then it'll become more okay.
Right, absolutely.
Like, oh my God, did you hear what so-and-so did? You know,
right, absolutely. I can share you my very first experience when, like I said, I was very young when I started my internship in the reproductive world. And I remember I was sitting in the waiting room waiting for my interview. And there was this woman there who was discussing the process of egg donation with just a family member. And that was the first time I was exposed to it. And I was thinking, she's talking about another woman who's going to donate her eggs to another woman so that, you know, the other woman can create an embryo and get pregnant. And to me, it was the first time. And I was like, oh, this is so, it's unusual, it's new, it's, you know, I was shocked too. And, you know, over the years, of course, I've, you know, become well acquainted. When the first time I mentioned it around the dinner table at home with my family, they were like, what are you talking about? But, you know, and now they understand that it's just another way of people having a family. Sometimes
they wouldn't have otherwise had, though.
Right. So, for example, just people might not even think about it. Maybe at a young age, a young woman had a cancer and she had to go through chemotherapy. And, you know, that does affect ovarian reserve. And when she's an older person, she might not be able to use those eggs because of the chemotherapy.
Like she has them, but they're not useful.
Or, well, because of the chemotherapy, she might not have them either.
Okay.
So now she has to resort to using an egg donor because of this unfortunate incident that she had as a young adult.
Right.
So now we have, you know, the ability to actually freeze eggs as well. So a young woman who has cancer now is also, if it's an option for them, they're allowed to be given the option.
Freeze the eggs before going through chemo.
Right, so that later on she can use those frozen eggs.
Right.
But some women don't have that option, and cancer is very aggressive, and they have to do it right away. And later on, when they're ready to have a family, they have to think about, okay, how are we going to have a family if I don't have eggs? And you know, they might try and it's just not working. And they do want to have a child. They want the husband's DNA and sperm to be involved. She wants to carry the child. So this family would be, you know, it would be an option for them to use an egg donor. So basically, a young woman who's from the age of 21 to 29, who's perfectly healthy, not a smoker. They check their, you know, carrier, like genetics, let's say. They want to make sure that they're compatible with the sperm
Right.
They're able to donate their eggs, and so they take the young egg from the young woman. They take the husband's sperm. They fertilize, create an embryo, and they put the embryo back into the husband's wife, the mother, and she's able to carry the pregnancy and have that bonding for 9 months with the child.
Right.
So that's how egg donation works.
Okay.
Now,
I love the way you explain that. I love it because it comforts me as a mother. It comforts me as a woman, and that's, I think, the biggest problem that when people, just in general, they're so uncomfortable with that whole process because they feel like, oh, I don't want to feel like I'm robbed of anything, or they're not giving me the full experience. Technically, it is a little bit altered, yes, like as you explained, but you're trying to explain things and make it easy for them to process it because, you know, yes, okay, Hima, it's not her egg, but it's a healthy egg. It will be a healthy baby. You try to do your best to make sure that that is the case, and you screen them
Right.
Right.
So there's a vigorous screening process. So we want to make sure that the donor is drug-free, the donor doesn't have any infections, her mental health is healthy, she goes through a psychological evaluation. There's a legal process that they go through to ensure that, you know, everybody knows what they're doing, and, you know, the donor is donating her eggs to the intended parents. And now the intended parents are the, you know, the parents of that egg.
Right,
so they get to decide what to do with it. So we really try to work hard to make this process simple. We try to make it safe. We work in a team with the reproductive endocrinologist, with the attorneys, with the psychologist, with the genetic counselors. All of this is done to try to have the healthiest baby possible. I mean, nothing is guaranteed, of course.
Of course.
But we try
But
everything.
that's a lot of moving parts
Right.
on that chessboard to make sure that the end game is as it should be, because everything goes through that mother's or that father's mind. Like, what if this happens? What if that happens? And rightfully so. So that's why you're screening in so many ways, and that vigorous, like, checking off every box and making sure that they feel secure when they take that baby home.
Right, of course. And, you know, let's not forget, these couples are the ones who have been through it all. They did it all. They tried it all. This is something that now they have to decide, are we going to go through adoption, or are we going to try something like this? And it's not for everybody. Some couples decide to go and adopt, and that's perfectly fine and fantastic. But there are couples who will choose to have children with an egg donor or a surrogate mother because they want to experience parts of the process themselves. Either that's pregnancy, or maybe it's going to be their biological child, even though a surrogate mother is going to carry it. Or the father's sperm will be used, and the genetic material from that side of the family, or the other way around. Maybe we have a perfectly good egg, we need to have a sperm donor. So it goes both ways.
Let's, as like detailed or short as you would like to make it, let's talk about the surrogacy process, because I think people know about in vitro more, but surrogacy still kind of is a new concept in our community.
Sure, absolutely. So surrogacy is usually for the couples that have a physical problem with the uterus, or the mother can't carry the child because she has a different illness that is not allowing her to take the baby to full term. So some examples of this include women who have fibroids, who've had surgeries, who have different, maybe they've had cancer and they had to remove the ovaries and the uterus. They've had a hysterectomy. So that's where a surrogate mother comes in. A surrogate mother is basically carrying the embryo to term. So the baby is growing inside of her uterus, but the embryo, the genetic material, is usually from the mother and the father. Now, we do a lot of work where the birth certificate after the birth of the baby has the mother and the father's name on it. So at the end of the day,
because it is there.
Right, exactly. So again, the surrogate mother goes through a lot of screening. We support them all throughout the pregnancy. We buy them health insurance, life insurance. We help them with maternity clothes, with cleaning the home, or if they need help with taking care of the children. We try to make this process...
Taking care of her own children if she has it.
So let's
just to clarify.
So as if she has to go to the appointment,
of course.
then, you know, somebody has to take care of her child, and we'll obviously help with that. But the important thing for a surrogate mother has to have had previous pregnancies without any issues. They're healthy. It would be great for them to have a support system, like a husband or a mother or sister, somebody who can be there for them throughout the pregnancy.
Absolutely.
They have to be healthy, and, you know, they have to be healthy. Both egg donors and surrogates, this is something voluntary, and we don't want them to be hurting themselves. We want to make sure they have the children that they will have. Like, for example, the egg donors, the eggs that we take, we're not taking away anything they're going to potentially use in the future. We're just catching some of those eggs that they were already going to lose that month. Same thing with the surrogate mother. Usually they've had their children. They don't want to have any more children, and now they're ready to help somebody else. Right. So it's a beautiful process. It's just another way of reaching a couple, having a child with, you know, with these wonderful people who are willing to help and be compensated for the work that they're doing.
as a mother who's been through pregnancy twice, I've had beautiful pregnancies, and even if I had difficult pregnancies, it's something that I imagined myself. I was saying, you know, like, what if like a really close friend of mine or a sister or brother, somebody needed me to do that whole surrogacy process. I'm just trying to like paint a picture. Yes, you have that child inside you and you're nourishing them and you're taking your vitamins and you're making sure you're eating healthy and you have a very safe womb, an oven for them to bake in, so to speak, with their ingredients. I think it's one of the best gifts that you can give to somebody without taking anything away from you. Even though you're housing that child for 9 months, and yes, they're a part of you, it's the most selfless thing I feel like one can do for another.
Absolutely, I totally agree.
And I think it's really beautiful.
It is beautiful. There's lots of times that couples make this really difficult decision and take the first step, and they're very nervous, and you know, they want to make all the accommodations of like, I want to be the first person to touch the baby, I want to be the one to cut the cord, I want to be the one to do skin to skin, and of course we make all of that happen. But when the time comes after they spend 9 months with the surrogate and having a relationship with them, and the day comes where the baby is going to be delivered, and both, you know, the surrogate and the intended mother are in the room together, it's just such an emotional event. People are like, the intended mother is like, please take care of the surrogate, make sure she's okay, you know, and all of that. All the walls you see slowly coming down, and it's just a really beautiful moment. And I hope that we're able to share this knowledge and this information with our community, because my goal is, how can Armenian families help other Armenian families? You know, we have this topic, especially now after the war, and everybody's trying to do their part. And when I went to Armenia during that time, I really, really thought, you know, this is where I have to help Armenian families realize that if you're an Armenian mother who's had a successful pregnancy and you're a healthy person, you can really change another Armenian person's life and help give birth to a beautiful baby. So it's just another way of being selfless and also being compensated for a truly heroic thing that they do.
Yeah, absolutely. That is amazing. I love the way you said that. I think that if anyone was gonna collectively win, here too, I'm only saying it որտեղ հնարավորությունները այնքան շատ ու այնքան լավ է, որ ասենք kind of կարասելի յոլա գնաս, you know, in America, the Armenians here, yes, we're very resourceful, you know, we've, you know, established ourselves and things like that, and we're always the ones that are doing our best to help our family and friends and even people we don't know back home. So this whole surrogacy option and enlightenment that you're giving them is really very beneficial for people over there. They live pretty healthy lives. A lot of them in the Gyured are also like very like cautious of what they're eating and how they're living, and you know, if they've already had children, they already know that experience, and most of the time the money that they get helps not just them and their spouse, but their children, maybe their other, you know, relatives that are around them or living with them. So I can't see any reason why this wouldn't be an absolute blessing for everybody involved. And it will be like, you know, those walls come down, as you say, and you become less defensive and more like, okay, they're helping me and I'm helping them, and this is, it literally takes a village to create this child.
Right.
And the amount of work and how vulnerable we become just to have this little human be born is just, you know.
Yeah, it's very nice.
It's very emotional.
Yeah. Another reason or another thing that Simple Steps was really important to me was to really spread the knowledge. I had so many friends that were career driven, or they got married late, or, you know, I've always reminding them, you know, girls, you gotta do this blood test, do that blood test, check your ovarian reserve. I really want women to be empowered of knowing that, you know, there are ways that we can control that ticking clock now, where we can freeze our eggs. We can freeze our eggs, we can decide when to have children. Just keeping, this is just an example of just trying to educate our community, keeping people up to date, providing the support that they need. We try to have seminars here so that we can educate families with all the different technologies that are out. Now you can test your embryos for all the chromosomes before you become pregnant, just to kind of rule out miscarriage and, you know, Down syndrome and things like that.
The eggs that they put away.
So when you make embryos, when you do in vitro fertilization, you have the ability to test the embryo, to put a healthy embryo back inside of the uterus. And it's a lot of technical words, it's a lot of things. So to help the families break it down, we have seminars at our center, we take phone calls, we answer questions. So we're a fertility support center as well. We also have nurses who go to homes to help with the injections, because as you know, with infertility, you know, we take lots of shots. People who've never taken a shot in their life now are expected to take, like, you know, a couple shots a day. And some of the injections, it depends. It depends.
I feel like it's so much.
It's a lot. There's couples that are taking 2 shots a day for about 10 days. And they're, you know, it depends on the doctor you're seeing, their protocol, and what they feel will give the best results. But the medication is very much the same for all of the doctors. And so our nurses are trained, they go out, they provide a service if you need to have some of the injections are intramuscular. It's difficult for somebody to give it on their own. Their husband can't do it. They don't want to make a mistake. So we have very educated nurses that can also go to your home and help you with those injections if we connect with your doctor's office and we get the right orders. And we provide 24-hour nursing support to all of our egg donors, to our surrogates.
That's amazing.
We're just trying to fill in the gaps. We're trying to make this process of infertility become as simple as possible. Try to help educate families, make sure they know what's out there, what they can do. And for the most difficult cases, we want to help them through this egg donor or surrogacy process that's called third-party IVF.
I think that it's really... like you mentioned, it's a miracle and it's a blessing, and it's a very selfless thing to do. If one was trying to do that, a full woman was trying to do that, how does she go about it? What's that process like?
Sure. So if you're a woman who's interested in surrogacy, so the first thing you should do is, well, if you're from the ages of 21 to about 40, and if you're a healthy person and has had at least one healthy pregnancy, then you can give us a call and we can start the screening process. So it's very simple. You would just fill out an application just to have some background medical history, so we can figure out that you are a true candidate for surrogacy. If you do pass the first application process, then the first thing that you will do is you will see a reproductive endocrinologist to do a general health check. What they will do is they will check and make sure that you are in good health, you're drug-free, and they will check the uterus, because, you know, they're going to put an embryo inside of the uterus. This is what the surrogate mother does. We want to make sure that the inside part of the uterus is completely normal and there are no polyps.
It's not hostile.
Yeah, it's not. Right. It's very nice. So usually the procedure that they do is something called a sonohistogram, which is when they put a little bit, it's like a pap smear. They put a small catheter in, so they put a speculum in, they put a small catheter, they inject water. So the uterus is like this, so when they inject water, it kind of goes like that. And they do an ultrasound to take a look at the cavity to make sure that it's completely clean and there are no polyps or anything that's going to, you know, stop the embryo from implanting. They'll also do a pelvic ultrasound that will look at the walls of, you know, the endometrial lining, take a look at the ovaries, and just a general anatomy. So once you're done with the reproductive endocrinologist and they give a green light that you have medical clearance, the next thing we do is we ask a psychological ask for a psychological evaluation. We want to make sure that you understand what you're doing, that you are ready for it, you're not suffering from depression or anxiety or anything that's going to cause any trouble to the pregnancy.
Right, of course, because stress is a huge factor.
Right.
Of course.
So once the psychological evaluation is done, then we have a legal counsel. So we have, the surrogate has her own attorney and the intended parents have their own attorney to make sure that there's no conflicts of interest. And they both sign a contract where it's really detailed as to what is expected of the surrogate, what is expected of the intended parent, what's going to happen, how much is the surrogate going to get paid, when is she going to get paid, what happens if she has an early delivery. So it's a very detailed contract to try to prevent any unanswered questions. So it's to protect both the surrogate and the intended parent. So once the legal contract is done, then the surrogate is able to start her treatment with the reproductive endocrinologist. So during this treatment, when she's getting ready for the embryo transfer, that's when they put the embryo inside of the uterus. That's when we purchase health insurance, life insurance. We do everything to make sure that, at no cost to the surrogate, that she's safe. And if something were to happen, then she will have proper medical care.
Of course. Yeah.
So once the embryo transfer is done, we wait about 10 days to find out if pregnancy took place. And hopefully it does. And if it does, the surrogate continues to take the medication to about, 10 to 12 weeks, depending on the doctor that they're working with.
Oh, they just take medication.
Yeah,
okay.
Medication to prepare the uterus for the transfer.
Yeah.
And once they're about 11 to 12 weeks pregnant, then they will stop the medication and the natural pregnancy will take over. And they won't have to be taking any additional medication.
Maybe like the vitamins, prenatals.
Yeah, of course, prenatal vitamins, like you would if you were pregnant.
Of course, yeah.
Right. And you would, a lot of surrogates see their own gynecologist who they're comfortable with, they've delivered with their OBGYN.
Exactly.
So we try to make the process very comfortable for them. And the screening process is not difficult. It's just meant to make sure that you are healthy enough, you're going to be able to have a healthy pregnancy. This is not going to be, something that's going to interfere with your own health. And egg donors go through a very similar screening process. They have to see the reproductive endocrinologist to make sure that they're healthy. But instead of checking their uterus, we're checking their ovaries, their ovarian reserve, because we want to get as many eggs as possible from the egg donor. Well, that's not correct. We want to get enough for successful cycle.
Right.
We really don't want to put the egg donor in danger or anything like that, so we don't take too many eggs.
Right.
I do want to emphasize for egg donors, people who are from the age of 21 to 29, they have to be younger because the egg quality is a factor of age, and most women need an egg donor because maybe they are over the age of
29
or 35.
Yeah.
Or somebody who had diminished ovarian reserve at a young age and they don't have it. So egg donors, it's a sort of a myth that women think that they only lose one egg a month.
Yeah.
Well, one egg will grow and it will ovulate and it'll have the potential for pregnancy.
Right.
But we're losing hundreds of eggs. And instead of us losing that month, hundreds of eggs,
we can put some away.
We're just catching some of it from the egg donor and using them.
It's like a school of fish. And then you just kind of put a net through and see if you can. I mean, there's no harm in it, though.
Right.
There's really no. I mean, people need to kind of joke about it and kind of use it as an analogy and just like, oh, okay, it's okay.
Yeah, so
I'm not causing harm to myself. They're gonna fall, so I might as well catch a few.
And it's they're gonna be able to have their own children, obviously, when they're ready to have a family. And again, if this egg donor waits until she's 40, she might run into similar issues.
Of course.
But if within the normal range. So they go through a screening process of, medical screen, psychological screen. They also see an attorney to make sure that they know what to do and when they will be compensated and, to protect their safety. Egg donation process is much shorter. It can take a few months instead of 9 months where, somebody's actually pregnant for 9 months. Egg donors cycles can be very quick or it can take up to just a few months.
Yeah, of course. And I want to also emphasize, let's just say you're a single woman who just wants to put away your eggs while you're still younger.
Right.
Okay, I'm 35. Had I not have had children, I would 100% put my eggs away. Like maybe last year, the year before that, or right now, hurry up and do it, put it away. Maybe I'll meet a man 5 years from now, 10 years from now, you know, just to have the healthier, younger eggs and just put it in the fridge for a while.
The difficulty is when women are younger, just like anybody else, when you're like 25 years old, it's probably the best time to put away your eggs.
They don't really think about that.
But first, you're not thinking about that. And second, you might not be able to afford it because, you know, and we see a lot of egg donors now that are donating their eggs and then using that money to actually freeze their eggs. It's just an option. But you know, if you really want to if you really want to freeze your eggs, then, you know, we will help. We will find a way. It might take some savings, 1 or 2 years. When you're 25 years old is nothing. But when you want to freeze your eggs, the sooner you do it, the better it is, because age is and quality of the egg
is a huge factor.
They're factors, right?
Yeah, absolutely.
So they would do a simple test, something that I recommend all women, just to like gauge your infertility. Just like you go and you see your primary care doctor and you want to make sure you're healthy. I always tell women, just check your anti-Müllerian hormone, your AMH. It kind of gives you an idea of where you are with your ovarian reserve, and it can help you make decisions. Are you going to, if it's not a very good number, if it's very low for your age, then you might want to think about this more seriously than if your numbers are within normal range and you still have like 1 or 2 years to think about that. But, you know, women should be tested. Women should keep up to date. This is, you know, the ticking clock doesn't have to be that loud.
Yeah, exactly. Absolutely. I like that. Yeah, and anti-Müllerian hormone.
So it's AMH. You can do it at any day on your cycle. You would need a doctor's order and you would get a number and you would consult with your physician to know if that number is normal for your age.
Okay, and what does that number dictate?
It's kind of checking to see how your bank account for your eggs, your savings, how many eggs are still in the ovary.
Oh, they can tell?
Well, not exact numbers, but that number that's checking for a specific, the anti-Müllerian hormone will give us an idea of how it is.
Yeah, more or less.
Right.
Okay, cool. It's always centered on the women, or like most of the time people will ask, well, why aren't you having kids? And they'll say, oh, you know, eventually when they come around to talking about it, we're having some fertility issues. Oh, well, you know, what did you do? Why do you have the problem? And it's always the woman who has the problem. But a lot of times it could be the man for various reasons. And it doesn't mean it's taking away from any kind of masculinity or anything like that. Or performance or whatever. So I feel like it's such a
taboo topic. Again,
very taboo topic, especially because it's regarding men.
Right. I've had patients where we know for sure it's the men, and you know, it's not taken lightly. But we have the same issue on the women's side. But men can also, of course, suffer from infertility, and it's much simpler to identify if it's a male infertility than a woman's. It's much cheaper to do testing for males, and it's easier. So I would say for those families who've been trying for at least a year, I would at least start by sending the male partner to go get tested. It's just something called a semen analysis, and they're taking a look at different components. They're looking at how the sperm is moving, how much of the sperm there is, what is the shape of the sperm, the head, the neck, the tail,
how fast they're going,
what direction they're swimming.
Right, maybe they need directions of where to go.
And so a lot of times, if you identify that it is the male, you know, treatment is completely different. And sometimes women can avoid doing you know, some tests that are painful and more expensive if we identify.
Or the shots.
Well, maybe the shots, they might need it, but a diagnostic test. Like, for example, if it is a malefactor infertility, most of the time you need something called ICSI, intracytoplasmic sperm injection. That's when they'll take the sperm and they'll inject it into the egg. And that's how you overcome a malefactor infertility. Not all, but most.
And can I just emphasize, nobody needs to know that you even put it in a little petri dish and mixed it together. No, it's still your sperm, it's still your egg.
Right.
It's a private process. You guys can go get yourself checked, find the best way to use the egg and the sperm and create an embryo. At the end of the day, if an embryo is created and it's healthy and it's placed back into the mother or a surrogate, that's all that matters. I feel like they're so offended that you're questioning that, and it's it's like has nothing to do with your manhood or your as a man.
And I think once they, at some point, I think everybody comes to the conclusion that we have a goal, we want to have a child, and we want to do everything possible.
Yes.
So as difficult as it is, I have to also give them credit. People do come around and they do understand how important it is to be a partner in this process.
Put your ego aside and look at the bigger picture, because as women, I think we've taken a lot of crap for something that might not have even been our fault or problem, and I just want it to be okay to be talked about, and just you can still analyze it and see what's going on. Maybe it is the guy's fault, maybe it's not, or a problem
so
or issue or whatever.
Don't identify fault. Just work together to solve the problem.
Exactly. Sorry, I shouldn't have even used fault, but issue. So I love that you said that. I had no idea about that, and something as simple, gentlemen, if you're watching, smoking lowers your sperm count, whether it's weed or cigarettes or whatever it may be, just to make sure that they're healthy sperm, and eventually, because that sperm's going to become your child, there's so many things that you can do that are maybe a little bit easier to process. Right.
I mean, if there's one thing I do want to say, this is a public service announcement for everybody. Hookah is bad for everyone. Hookah is not good for the ladies, for the ovarian reserve and the quality, and as well as for the men. So it's really important to kind of live a healthy lifestyle, pay attention to those things. Of course, we're not asking you to live with no vices in this world, but if you are actively trying to have a child, or if you are a woman, you really have to think about it. Those eggs are going to live with you for as long as you're going to live, and you don't know when you're going to have children, so you might want to think about some of the things that you do that can potentially affect fertility.
See, I didn't know that. I mean, I know there's tobacco in there, and I do it maybe once or twice a month for an hour or two, and it is a vice for me. I really enjoy hookah, and I smoke cigarettes, but I've had kids, and I was able to not smoke any cigarettes the minute I found out I was pregnant, and until I was done breastfeeding, and then some. So, I just think, just in general, the healthier lifestyle is, we forget how important it is just while you're still very healthy and fertile, and you're able to have a child. And later, maybe you can be
of course.
more.
It's just we're talking about the subject, and a lot of people don't know. I just felt like you have to mention it. And this is what these conversations are all about. I really want people to just,
put down the hookah for a little bit.
Or just know. I mean, I've done it myself, but, I was lucky. Dr. Sapilian is somebody I worked with for about, 10 plus years of my life, and he's one of those professionals that will remind you, it's bad. Think about this, keep yourself up to date, and that's really important. And I just, when I opened Simple Step Fertility, the infertility support part of it was to help engage our community, help educate our community, provide them with the knowledge and the resources, and to really help them through this difficult process, because those couples that really need the third party help, they're really struggling, and there wasn't a system within our community.
The amount of work that you have in the past and as of recently put in Armenia is really incredible. We fought so hard to save people, but we also need to fight even harder for the future generation that hasn't even been born yet, which is where you come in. And sorry. I told myself I wasn't going to do this, but I just think it's really important to talk about the work that you did, and the importance of not just you, but collectively, everybody over there.
Right, right. Yeah, thank you for mentioning that. During the war, we had a lot of organizations that really jumped on the ball very quick. One of the very first ones was the Armenian Medical International Congress. That's, the president is Dr. Spilyan. And that is an organization that brings together all of the, medical associations all over the world that have to do with Armenia and from Armenian descent. So it's a collaborative effort. It brings everybody under one umbrella. Okay. And because of the work we were already doing with COVID, we were able to really just kind of switch gears and see what can we do to help for the, with the cause of the war. What are we going to do? What is our role as healthcare professionals? And, very quickly, we have so many resources all over the world. We were able to start gathering supplies, get in touch with the Ministry of Health in Armenia and Artsakh, and really start thinking about, what can we do for the front line, what's happening in Yerevan, all of this stuff. And we were meeting via Zoom every Sunday to try to make some of these things realities and not just conversations.
Of course.
I'm also the president of the Armenian American Nurses Association, and we were really, really proud that we had so many nurses, like white coat soldiers, that just stood up, and we had about 25 nurses that went to Armenia and really, really did their very best to try to help with whatever we could out there. We had a lot of wound care nurses, we had trauma nurses, we had nurses who wanted to go to the front lines. It's always very difficult from here, yes, on their own budget. Who just wanted to go and help out and do as much as they could. Even with COVID, we had COVID and a war going on. So we had our own difficulties, of course. It's not easy to just show up and try to penetrate, a working body. And, nursing in the United States and nursing in Armenia are completely different. They have different scope of practice. A lot of nurses here are doing things that doctors are doing in Armenia. So to find that balance,
like PAs and things like that.
Right, and just regular even RNs who can do wound care and start IVs and do certain things that doctors are doing in Armenia.
Right, of
so it was a great learning experience. I've seen so many nurses make so many differences for the soldiers, that were recovering just from holding their hand to sitting with them to changing their bandages. So it really was, our community just I've never seen anything like that before. We just kind of stood up, and I hope that we continue because we really need it, both as a diasporan and also as a local Armenian. We really need to work together to further and not let this happen again.
I didn't expect anything less because if we ever do get together, it's always at a time of complete chaos and fight or flight situation. So I really think that's amazing. How long were you guys there for?
We were there for we had nurses who went in different increments. We had 5 nurses that went and stayed about a month, and then we had a few more, and they just added on and added on. And everybody stayed as long as they could because everybody has different schedules and everybody has families and things like that. But a typical nurse stayed at least for 2 weeks, at least for 10 days.
Wow.
And, we have ongoing projects. I know Eternal Nation has ongoing projects to help the soldiers who need prosthetics. AMIC just recently, with the help of the Armenian Medical Society, was able to raise funds for the oxygen machine in Armenia. And the nurses, the Armenian American Nurses Association, we continue to support and try to help the professional aspect of nursing in Armenia. We have nurses, the first time that the nurses went to Armenia was for the Gyumri earthquake. That's how the Armenian American Nurses Association was actually founded by diaspora nurses who were working, who kind of dropped everything and went to Armenia and did everything they could to help during the earthquake. And sort of that, that
and it's not Red Cross related, it's just us getting up and going back.
And that energy has just, continued over the years, and we have more and more nurses joining and wanting to help. The amount of support, the amount of nurses that came together to bring supplies, that contacted hospital administrators and just got up sat in an airplane and went to Armenia was just amazing. And it just tells you what we can do as a collective community, and I hope we continue.
Absolutely. That was beautiful. I know that as a professional, we will continue to do it. Even though and we do it, we come back and we make more money and we support our family and then we go back again. Not because of guilt, not necessarily, even though that's there all the time, but because of this feeling that I must, without anyone forcing them. These people were not forced to go. No. These nurses, they went.
Because it was their duty.
It was their duty.
It was their calling. It was something that some people had just gotten hired and they had to ask for time off because this is what they had to do. This was something they had to do for their heritage, for being an Armenian. This was that tax, that diasporan tax that we had, and it was beautiful. It was very nice. It was definitely. Moving to see our community the way it came together.
To say the least, yeah, absolutely. Very moving. Yeah. I want to end on a note where it's a little bittersweet. I understand that a lot of mothers have lost their sons who are 19, 20, 21 years old. Perhaps they're in their mid to late 40s, which is difficult to have kids. Probably they weren't even imagining that they would have a child at this age, but given the circumstances, they're choosing to do so. How difficult is that, and how can we help, as we meaning us here?
Well, I think that Armenia is taking the steps necessary. I was lucky enough to meet with the Ministry of Health in Armenia and to discuss some of the things that were going on. And they really have a lot of mothers that really want to have another child now because of the loss. This is how they're sort of dealing with some of that grief, coping, yes, very good word. Armenia is taking a look at it. Armenia is creating programs. Armenia really wants to help its young families be able to have more children. I applaud them, and hopefully we can collaborate. There's lots of leadership here in the United States that goes and helps, and lectures, and doctors are trying to now just create programs where we can learn from each other a lot more. And I feel like Armenia is taking the right steps to try to help that population, but we can always just go to Armenia. I think that more than just donating money these days, I think that what Armenia needs is that professional elevation, is to go there, be there, share with them, collaborate with them, create a project with them. And sometimes it's more than just about money. It's about sharing knowledge. Knowledge is wealth. So that's what I would say.
Absolutely. And the women who are a little bit older, I mean, would you advise against them just naturally getting pregnant? I
mean, they're of course trying, but they may be older because they already have lost children that were probably 17, 18, 19, 20 years old, maybe even older. They're dealing with the same things the women here are dealing with. There might be women there that might need egg donors and sperm donors and surrogate mothers, and families. Infertility is present both here and in Armenia. Yes, of course, it's a little bit more difficult in Armenia, and I think the numbers are a little bit higher, but they have the same struggles, same type of issues that they have to think about.
Everything that we've discussed, there's so much more to privately discuss with each individual patient or just people inquiring. I think we covered a lot, but tell us where we can go to reach you or a member of your staff, website, everything like that, so I can have that on the
Sure. You can reach us on our Instagram and Facebook at Simple Steps Fertility. And we're located here at 450 North Brand Boulevard in the beautiful Glendale.
I love the wealth of knowledge that I get from interviewing each person, because even though it doesn't pertain to me, I love to understand in all the different ways that we help each other and can help each other. So thank you for your time and your staff here, and the amount of work that you put in. I hope that you continue to do, because it's something that unfortunately will continue to be present. I don't even want to use the word problem, but it will be something that a lot of people will need from you.
Right, of course.
That knowledge and that help and guidance. So thank you.
My pleasure. Thank you for the invitation. This was so nice. Thank you.
My pleasure. Thank you. And until next time, if you want to reach Tagui and the people here at Simple Steps, we'll have the information on the screen for you. So take care of yourselves, and we're always here to help. Until next time.